We knew going in that he would have that first surgery about at a week old. We did not expect to have an emergency surgery at 24 hours old. I was induced here at the University of Iowa Healthcare. Aiden was born emergency C-section. His heart rate dropped, so
his life expectancy was only a few hours. So it was a lot going on because once he's born, usually the mom, can hold him and stuff.
They realized that he was actually getting too much oxygen flow, and so they had to do an emergency surgery on him when he was 24 hours old, and it was called pulmonary artery banding. So that surgery went really well, and then about 6 days later, then he had another open heart surgery. Aiden had hypoplastic left heart syndrome, which really means that his left side of his heart didn't develop as it should have. They're trying to make that right side of the heart do what the left and the right are supposed to be doing.
Basically, I think they just reroute some of the heart, the way the blood pumps from around the heart to different parts of the body.
That was a difficult surgery because one of the side effects is that you get really terrible migraines and headaches because your blood is flowing differently in a different direction. And so it was really hard watching this 5.5-month-old baby have these horrible, terrible headaches. Aiden was in the hospital for 41 days from when he was born till when we went home. And during that time, we also had to learn how to take care of this baby that is medically complex. About a year ago, we went to our yearly checkup. They noticed that Aiden's protein levels were not where they thought that they should be.
He just loses protein through his blood, and he can't keep on muscle mass. So we gotta try to have a high protein diet to try to pump in as much protein as possible because he doesn't keep it.
One thing that we do know cures the protein losing enteropathy is a heart transplant. Later this summer, we're supposed to meet with the transplant team, and at that point, we will start taking those steps to get on the transplant list.
And then hearing that now when he's 8 years old, heavy news to hear.
Now Aiden is 8 and he understands more. So when you're talking about things that aren't quite going as right, he's listening to those conversations. Right now, Aiden does do really, really well. The only thing that you can really tell that essentially I would say is wrong is that he gets tired very, very easy and very winded.
He kind of gets frustrated sometimes, but he still tries his best, and we still have a lot of fun. He loves swimming, he loves being in the water.
So I think with what my hope's for in the future after he does get that transplant and is fully recovered, that he will have that energy that most other kids have. I would just like him to be happy and healthy.
He's just a true little warrior, and he's been through so much, and he just keeps a smile, and he's still happy. I just kind of look at him as kind of like a role model almost, because if he can do it, then I know I can do it, and I can be there and help him through anything.